Hi, I am Basanta Pathak, a medical student in the statistician. Welcome to Handy Research. In episode 7, we learned that selection bias occurs when the wrong people enter our dataset. Today, we discuss something equally dangerous. What if the right people enter the study, but the data we collect about them is wrong? And that is called the information bias. And unlike selection bias, that distortion happens during measurement. So let's understand it deeply. Oh, before jumping in the information, अच्छा मिर्ज़ापुर की एक डायलॉग है कि कालीन भैया कहते हैं कि मुन्ना भैया अगली बार आपके घर पहुँचे और आप नहीं हुए, रिक्स है। तब गुड्डू भैया वापस उसके रिप्लाई में कहते हैं कि मुन्ना भैया अगली बार घर आए पर वापस ना लौटे तो रिक्स तो उधर भी है। And I think that is the selection bias and the information bias. Like there is both risks in each part, and let's understand it deeply. Information bias when measurement distorts truth. So when does this information bias occur? Information bias occurs when exposure, outcome, or covariates are measured inaccurately. Because of this measurement, the association between exposure and outcome becomes distorted. In simple words, the data is wrong. The data itself is wrong. So let's jump into the core concept. That is the misclassification. Most information comes from misclassification. There are two types. What it is non-differential and differential misclassification. So understanding this difference is critical. So let's jump into the non-differential misclassification. What is mean? It means that when measurement error is independent, when measurement error is independent of the other variable, of other variable. Let's take an example, our famous example, that is the smoking causes the lung cancer. Suppose smoking status is misreported in both cases and the control. So both groups underreport the smoking at the same time. Both group underreport smoking at the same time. So what happened then? Then it becomes the non-differential, because that is the general rule of the non-differential misclassification is for binary exposure or outcome, it usually biases the results towards the null. It weakens the association and uh, like random measurement error usually dilutes association. Always remember that. Next, jump into the differential misclassification. What is it mean by measurement error differ between groups? For example, our famous example again, that is the smoking causes the lung cancer, but this time smoking is measured differently depending on the outcome. Like cases with lung cancer, remember past smoking more clearly than the control. Smoking more clearly than the control. And that is the differential misclassification. So what this bias can result? It results towards the null, away from the null as well, and reverse or even the reverse the direction as well. It is unpredictable and the dangerous. Now recall bias. So, what do you mean by the recall bias? It is a common type of the differential misclassification often seen in case control study. Let's take an example like childhood pesticide exposure and cancer. So, there is the exposure is childhood pesticide, and result is the outcome is cancer. So, while taking the information, cases may search their memory deeply and controls may not. So exposure measurement differ by outcome status. Exposure measurement differ by outcome status, and we know that creates destruction. Now, interviewer bias. It occur when interviewer collect information differently between groups. So interviewer collect the information differently between groups. If interviewer know who is case and who is control, then they may probe more deeply in cases. So how can we prevent this? Blinding can prevent this. If interviewer didn't know who is case and who is control, then he may not bias. Next is measurement error in continuous variable. Let's take an example directly like blood pressure. Blood pressure measured with measured with inaccurate device. Inaccurate device. Then a random error increases variability. It increases variability, like it reduces precision. So if systematic device always reads higher, it creates the systematic bias. This is the simple one. Like if we measure something with something outcome with the inaccurate device, then it obviously can generate the higher value or read the smaller value or reduce the value, so it creates the bias. Now the outcome misclassification. Not only exposure, outcome can be misclassified as well. Uh, okay, the example is using administrative database codes for stroke. Using administrative database is stroke. If there is the coding accuracy, like if coding accuracy is poor, like there is the guidelines or a coding accuracy, anything that we now for the diagnosis of the stroke, if that is poor, then some non-diagnosed or non-stroke cases also labeled as stroke. That is here as well. If misclassification equals across the exposure groups, what do you mean by that? That is the non-differential one. And if more accurate diagnosis in the exposed group, then it is the differential one. Now another is surveillance bias, that is the detection bias as well. So it occurs when one group is monitored more closely, like some for the randomized control trial or anything, patients on new drug receive frequent checkup, and that's why more side effect detected. So patients on new drug receive frequent checkup and more side effect will be detected obviously, and it appears that drug causes more adverse events. But is this the true value? No. That's why measurement intensity creates bias. Now let's compare the information bias in case control cohort study. So what happened in case control study? Which bias is common in case control study? I already discussed, that is the recall bias. In which that recall bias is common in cohort? No, recall bias is less common in cohort, but misclassification of exposure can still occur. Misclassification of exposure can still occur. And in randomized trial, blinding reduces that information bias. Now, final, that is the confounding versus selection versus information bias, the past summary of 3 lectures. What is confounding? Confounding imbalance between groups. It imbalance between groups. Selection, when does it create bias? Like who entered data set. And in information bias, what was measured incorrectly. That is the 3 different mechanisms. Now, can we fix information bias? Sometimes yes. Methods include, what are the methods? Like validation study, sensitivity analysis, using objective measures, blinding obviously, and standardized protocol at the end. But do you know, I always tell to fix the bias or to prevent the error, always the prevention is best. So how to reduce that information bias? There is always 2 stages, that is the design stage and the analytical stage. So let's go through one by one. In design stage, we can do use validated instruments. Same thing, standardized data collection, blind accessor, blinding also, and we can train the interviewer, and at the end use objective data is possible, yeah, where possible. Now in analytical stage, we can do sensitivity analysis, compare multiple data source, and measurement error quantify, like quantify measurement error. Remember, always ask, is this variable measured correctly or accurately? Always ask the question, is this variable measured accurately? That is the only question that reduce the information bias. Now let's jump into the summary. Information bias occurs when measurement error distorts the exposure outcome relationship. It can be non-differential and the differential. Measurement quality determines validity. Remember, selection bias, who entered dataset, and the information bias, was the measured data is correct or not. That is the keynote that you will go with home. Thank you for watching and follow Handy Research. This is your practical guide to research, season 1, foundation module, and episodes 8 done. We are doing till 100 episode, covering the whole detailed research from base to the advanced. Thank you very much.